I'm at Shaare Nefesh with Ami Silva and Bini Baumol, and we're here to talk about what is Shaare Nefesh and the pioneering work they're doing with ketamine-assisted psychotherapy here in Jerusalem. So I'd like you both to just introduce yourselves. Ami, if you'd like to go first.
Yeah, sure. So I'm Ami Silver, and one of the therapists on staff here at Shaare Nefesh. In addition to my work here, I work in private practice in Jerusalem, and also for the last number of years have been involved in MDMA-assisted therapy to treat PTSD, and different research initiatives that have been happening in hospitals and research centers in Israel, which we're hoping one day to be able to also provide here at our clinic.
Great, thank you, Ami. Yeah, hi, Bini.
Hey, so it's great to be here. I'm Penny, I'm a social worker and a ketamine-assisted psychotherapist. My role here in Shaare Nefesh is coordinating care and research. And I've been an activist and an advocate for psychedelic-assisted therapy here in Israel for a couple of years now. And Shaare Nefesh is a dream come true for me in some ways.
And who put this dream together? So what people, what organizations came together to make this happen? Because it's pretty revolutionary.
Yeah, so Shaare Nefesh Resilience Center is a joint project by Shaare Tzedek Medical Center, one of Jerusalem's leading hospitals, and the Jerusalem Foundation. And through an anonymous donation via the Jerusalem Foundation, this clinic was started. About a year ago, we started working on putting together a training, for training some staff. We have Dr. Sinai Oren, who's our medical director, psychiatrist, and doctor on the ground. We also have a nurse on our team, an administrative and research team as well, as our beautiful therapists who are doing the hard work. After the training, we started putting together the clinic. We'll talk maybe a little bit more about that. And Shaare Nefesh is offering psychedelic-assisted therapy, or more specifically ketamine-assisted psychotherapy, for people who have been suffering, whether civilians or army personnel, from the war, from the past year and a half of difficult security situation here in Israel, from symptoms of trauma, depression, or PTSD.
And why is this such a breakthrough to be offering ketamine in Israel right now for PTSD?
Yeah, so the situation right now has caused, or over the past year and a half, has caused the demand and the need for effective, fast-moving therapeutic tools to be put in place. And the fact that we have a public hospital at our back and the generous backing of the Jerusalem Foundation allows us to really offer an amazing therapeutic package. We combine psychotherapy, which is very much trauma-focused and informed, together with a dosing protocol that is very much flexible to the needs of the patient and to the dynamics between the psychotherapist and the patient. And in that way, we have ketamine being the psychotherapist's assistant in this process, which is so much needed. We have hundreds of thousands of people in Israel who are going to be diagnosed with depression or PTSD over the next few years. That's the forecast right now. And we've seen with some of the patients that we've already worked with, we have about 15 patients who've graduated our program so far, and similar number in the works right now. We see that depression and PTSD symptoms are definitely becoming less and less dominant in their lives, and allowing them to go back to work, allowing them to have better relationships with their spouses, with their kids, and for some of them even to address the traumatic difficulties of either, we had some of our patients were survivors from the Nova Festival, some are military personnel wounded in combat, pairing that together with PTSD. So we can see that the work that we're doing is definitely a step forward, and the fact that we can offer this through the very generous donation and backing in a way that they don't have to pay for it is also revolutionary. We hope to use this and utilize this looking forward into making this type of treatment not only standard but also covered or subsidized in some way by the Kupot Cholim, the HMOs here in Israel, and perhaps some of the government ministries as well.
Sounds amazing. Thank you, Pinion. Amy, I'd like to ask a question about psychedelic-assisted therapy. So there's lots of attention being paid to this around the world, research and funding and clinical trials. As a therapist, why do you believe, or what have you found to be particularly effective around using psychedelics and psychotherapy together, compared to just, the standard treatment of psychotherapy or, antidepressant medications, for example?
Yeah, great question, and it's a huge huge topic. I'll give a beginning answer, and I'll start by saying, both on the heels of what Penny mentioned, particularly the marriage between psychedelics and psychotherapy together, which is what we're using here in the clinic. Because there are treatments out there, especially with ketamine, where people are just given ketamine without therapy accompanying it, and part of what I really see as the potency here is bringing those things together. In a certain way, psychedelics, each different compound functioning differently, but writ large, have an ability to allow for what psychotherapy is supposed to be doing to actually happen and take place. The psychedelic is a catalyst or a lubricant, as it were, for the therapeutic process. In some cases, it really just opens up the individual's ability to undergo the natural process, movement toward healing that we as human beings in our biological organism and our emotional and cognitive makeup are really designed to undergo. What oftentimes happens, whether due to trauma or other intense events, is something happens in the system where we get stuck along the way. So we experience some overwhelming experience, whether one time or repeating, and something in our system starts to close down, something in our system starts to siphon off parts of ourselves that are too painful or just didn't have the safety and ability to really weather those difficulties in a supportive environment. And that's all natural. That's all natural adaptation. But when that continues to be our way of functioning, then we start to develop things that look like chronic depression, things that look like PTSD. Our whole life begins to be organized around not touching those experiences. And that itself becomes an oppressive pattern of living. The psychedelics, together within the therapeutic context, allow for both there to be safe accompaniment with a caring, attuned person, so you're not on your own, and to then internally begin to get close to that black box inside, to all of those feelings and experiences or parts of ourselves that we've distanced ourselves or split off from. That could include the traumatic experiences that people went through. That could include the different layers of shame, pain, fear, what have you, that have accrued on top of that. And here, in a different state of mind and awareness, in a different state of feeling, the whole system of the person, again, it's a multidimensional experience. The physiological, emotional, and mental capabilities all get to be released from those confines and then allowed once again to move and flow into that natural healing rhythm, all in that container of safe relationship. And I can't stress how much that is an important ingredient here, that the therapeutic connection and presence is there alongside the whole process. So in a sense, in a sentence or two, the psychedelics together with the therapy is here to try to help people return to themselves and return to their natural capacities as human beings.
Thank you. There's something around safety that you just said that's really important to expand into people's lives here in Jerusalem, say. And just the name Shaare Tzedek, or the Jerusalem Foundation, instill a sense of trust and safety, familiarity.
I think besides familiarity and trust, which are both very valuable, obviously, the fact that we have a doctor in the room and we have a nurse giving the medication and we have staff that is geared around, and a clinic which is designed around the needs of people in these specific states of mind and with these specific difficulties coming in, I think that gives not only the aura of safety, but actual safety. Um, like you said, the fact that we're connected with a hospital, we're connected with a foundation, and we're connected with research with Mount Sinai and other very, very important entities in this field is great for how we sound. But the way things actually happen in the clinic are, I think, the highest level of safety, the highest level of professionality, the highest level of care. And like Ami said, it's not only that you're not alone, you're in the session, on the ketamine session, maybe your mind is, somewhere pretty scary or somewhere pretty distant from where you're used to being, but you're there, and the person alongside you, which is not only making sure that you're not alone, is also the person that you've built the therapeutic bond and the connection, and you've primed together the situation to be beneficial for the psychotherapeutic process. And I think that adds a whole level that definitely not the underground, but even some of the psychedelic assisted therapy programs that are happening, and especially ketamine assisted psychotherapy programs that are happening, they don't encompass that beautiful marriage, as you said.
Yeah, and the aesthetics here matter. The design of the rooms, the comfort level. It's more like a living room situation, plush blankets and plants and tea, coffee. Like people can feel at home in the space.
An integration lounge that we designed especially for people coming down from their ketamine experiences in a way that we can still see that their safety is intact, but also that they have some space to journal or draw or just relax after a session. So even the design of the clinic, and I would say the mindset that we as the staff are creating in the space and bringing the patients into is also very important, and not only for our patients and for our clinic. I think safety and working ethically and professionally and doing the right research about this, all of this is definitely important for the entire psychedelic, like the psychedelic movement or the psychedelic renaissance, if you have it. We are doing everything we can in this clinic to make sure that these treatments are not only for, the type of patients who would be courageous enough to go there. We want this therapy to be available for people who are already suffering deeply from their situation, and we don't want to put the extra stress on them. So definitely we're making psychedelic assisted therapy a bit more mainstream or a bit more accessible, I think, and that's a big part of what we're doing.
And it might not be that patients are looking for psychedelics, they're just looking for healing. They want to feel
If
better.
they're looking for psychedelics, they're going to come to the wrong place, because they're going to have to go through creating a deep bond with a therapist in order to get that. And I think we're going to see some patients coming in initially interested with the ketamine or the other psychedelics in the future, hopefully. And I see this as a very positive way to get those type of patients into really important, good therapy, because that's usually what they need. There's something about the psychedelic renaissance that is putting the medicine up in the front, and what we're doing is we're putting the psychotherapy and the psychotherapist's bond with the client way up there. Yes, psychedelics or ketamine in this case can give you a transformative experience, but having that net of a therapist holding that experience and having the process, the long-term process, the couple of months of working hard, coming in once or twice a week, dedicating a couple of hours every time, not being allowed to drive home after, making sure they have the logistics figured out. Our patients are committed to the therapy, and I think that in a way that's also for their work and also for our work, it's very important that they know coming in that what they're going to be getting is the entire package and not just ketamine, for that matter.
And let's say I'm coming to Shaare Nefesh. I knock on the door, I phone up, say, hey, my name's David, I think I've got trauma, or maybe I've got PTSD, I don't know. Tell me about this ketamine thing. Maybe Ami, can you talk me through what would happen next? And if I get treatment here, who helps me, how many times, what order of treatment, what's the kind of typical journey for me as a potential patient?
Yeah, great. So first, it's important for me to note that we work as a multidisciplinary team. So you're going to meet a few different people along the way. The first meeting will be with Dr. Sinai Oren, with our psychiatrist and medical director, and probably with another one of the therapists together for an intake session. And in that intake session, the person will give some history, give some background, will ask the right kind of questions to really clarify the diagnosis and the situation and see, is this person fit for this treatment? It will also include, what questions do you have about ketamine? This is new for most people. What do you want to know? So there's a lot of psychoeducation that happens at the beginning too, as well as what to expect. Okay, and then we get to the protocol. Let's say somebody, meets the criteria, goes through the screening, and agrees to move forward. They will be paired with one of the therapists on staff who's going to be their accompaniment throughout the journey. That's going to be roughly 7 to 10 weeks of therapy, between once and twice a week. And, up to 10 sessions with ketamine, give or take. And we have some, it's not a one size fits all. We assess what's appropriate for each person, sometimes a little less, sometimes perhaps extending. But we're talking about a therapeutic process of about 2 or 3 months, coming for standard twice a week. Might be 2 ketamine sessions a week, might be 1 on, 1 off, depending. Each ketamine session is going to be about 2 hours with the therapist, an hour with the therapist in therapy, an hour with the ketamine effects, and then staying afterwards till the person is ready to go home. And as Penny mentioned, they're not driving, so it's an investment for sure. It's short term and it's focused to deliver potency. The other piece is that you'll also be meeting our administrative assistant and coordinator and Penny and our nurse on staff, who are all going to be part of the familiar faces that you're going to get to know as you're coming to the clinic multiple times a week.
This is all happening during wartime. So let's just talk about what that's like. So maybe, Amy, you can share some kind of real stories of working with clients. But first, Penny, can you talk about what impact the war has had on the actual birth of Shaare Nefesh? To what extent that was a motivating factor to begin this now as quickly as possible?
Yeah, so I think it would take maybe 5 or 10 extra years for this type of project to come into being without the war. And I'm happy and sad to say, actually. Across the board, the war has been a catalyst for new and old methods of psychotherapy being pushed forward. You can see the different trauma or PTSD organizations giving more and more care. We can see different, whether it's EMDR trainings or MDMA trainings or whatever it is, there is a surge in developing and providing different types of care for trauma. I think that the demand is so big that all of our efforts together are not going to be enough. It seems sadly like that's the prognosis. But definitely this type of project has been boosted forward due to the difficult situation. Not only is ketamine in its different forms, IM, IV, sublingual, not only has ketamine spread like wildfire through North America, I think here in Israel the time was right for ketamine to emerge. The fact that ketamine is a registered, recognized drug, a medical substance that's been used safely for decades, from anything from removing a mole on a child's arm all the way to cancer treatment, childbirth. Ketamine has been shown to be safe, and the system already knows how to work with it. And the fact that we can bring that into the room with psychotherapy, like Ami said, I think is a real game changer. And the war, maybe without it, we wouldn't be able to make this marriage, the match, so quickly and so effectively. I think also, if we take into consideration that the donation was given due to the situation, trying to make this project, at least to fund the runway into making this project, a spearhead of mainstreaming psychedelic-assisted therapy here in Israel. I think it's definitely evident that it has to do with that. I must say that I was recruited into this project by having conversations with Dr. Owen while he was serving in Gaza as a combat physician, asking me about ketamine protocols for soldiers who are injured and are being given ketamine and then evacuated and are tripping on ketamine while being evacuated from the battleground. And I think that was our first conversation pushing for this type of project was, I think, as early as November. Meaning, a month after the war started already, we were developing some kind of protocol. So I'm sure that the war has pushed this forward. We can see that all over Israel in psychedelic assisted therapy, whether through MAPS Israel's efforts with MDMA or other hospitals picking up the ketamine idea. I think that we're going to see a lot more availability and accessibility. And one more thing is that the fact that we're doing this in the public system and the fact that the Kupot, the HMOs, the insurance companies and the different government ministries have their eye on this means that we can be a potential game changer. And I think that since Israel has become an R&D lab for trauma treatment in the past year or so, hopefully this can be a beacon for the rest of the world. How symbolic would that be coming from Jerusalem?
Yeah, so it's unfortunately an R&D lab. It's a catalyst to war, but there's amazing things happening. And I mean, what are some of the experiences that you've kind of shared with clients as they're going through ketamine therapy during an actual war?
Yeah. So a few poignant stories that stand out. This was on an MDMA trial that I was involved in. We were set to do our first MDMA session the day after Israel assassinated Nasrallah. And so until 11 at night, the whole clinical team is sitting together on the phone with our client, so the participant. Are we doing this tomorrow? How do you feel about doing this tomorrow? What do we do if there's a retaliation? If there's if there are azakot, if there are sirens in the next day, how are we going to prepare for that? And actually, the treatment room that we were using for the psychedelic sessions is a mamad, is a safe room. So we show up, we shut all the iron windows, and come what may, we're going forward with it. All along that process, we kept having to pause and reassess and checking in with, first and foremost, the person receiving the treatment. How are you feeling? This is what's been going on. How are you doing? And again, it's re-triggering for people who've suffered military-related PTSD, and here they are, hearing booms, hearing news updates, having to run to shelters, and trying to dig into this traumatic material at the same time. Other people who we were treating were evacuees, families who lived in the north and from early on in the war with on the Lebanese border had to be evacuated to other places. So here they are living with their family, displaced, trying to figure out life in a different place, and at the same time going through this intensive therapeutic process, having to then move in the middle again because their temporary housing is switched. So there's just a constant juggling and reassessing, a constant checking in, checking for the pulse. In a sense, around the world, there's been psychedelic treatment for trauma in research and in treatment, and there's a way in which what we're doing here in Israel is aligned with the research happening around the world and the treatment happening around the world, and also very different,
Right.
because our circumstances are completely different. And there's a way in which it's culturally attuned treatment is, hey, this is our situation. It's way less than ideal. We're dealing with a lot, and we just have to be that much more sensitive to the progress and the unfolding of things as we're going along, and keep rechecking.
Two amazing additional examples from the work we've been doing in Shaare Nefesh would be reserve soldiers coming in their brief 3-month break between active duty components, and coming in with a pistol and a rifle, and we need to store that and do a ketamine session with them. Or Nova survivor that we were working with that completely detached emotionally on October 7th and until the treatment was still kind of avoiding any contact with what she experienced there, the people that she was with there. So we have also very complicated situations on what was the specific trauma of your PTSD, but we also have the setting and the set of our treatment is also, like Ami was saying, we're in prolonged trauma state, and therefore we need to take into consideration these kind of things.
Yes, it's amazing work, and you're responding to the needs of the nation and each patient that's kind of walking through the door. So thank you.
As the war continues, awareness to trauma and the need for therapy solutions are on a rise here in Israel. Could you perhaps tell us a little bit about using ketamine-assisted psychotherapy for working with PTSD patients? Go ahead, Rachel.
Well, it's a very exciting idea, and I think that both our institutions are studying this. We're going to be embarking on a very big trial so that we can answer several questions. One is the psychotherapy component with ketamine something that really adds to the experience? Because many people who use ketamine right now, who are prescribed ketamine by their doctors, it's really given more like a drug. You go to an infusion center and you get the ketamine infused in you, and then an hour later, you go home. But with ketamine-assisted psychotherapy, we're almost thinking about ketamine like a psychedelic, even though it doesn't work exactly the same way as a classic psychedelic. It does create an altered state of consciousness, and it does create kind of a bodily state and a mental state that is conducive to kind of having a different experience. And by getting somebody to really lean into talking about what that experience was like for them, it might loosen up some difficult traumatic material that otherwise wouldn't get there. Ketamine alone for PTSD hasn't really been shown to be amazing. I mean, it takes the edge off. It's certainly a good idea for somebody with very acute symptoms, get a little bit of an opportunity. But almost everyone thinks that if someone has PTSD, at some point they're going to have to talk about it. And this might be a way. So we're going to study it and see.
Yeah, beside this FA, I think one thing that ketamine do is like open for a person a space where he have like a quiet from his pain, mental and physical, and he can process, he can walk. So if you do it separately without psychotherapy, it might be just to give him a break, which can be. But if you do it with psychotherapy, so it's suddenly you can speak with a person about things that's or feelings that usually are not accessible or very painful to process or to touch. It's different than the work with MDMA and for a parallel purpose. But here the person do much of the work within himself with the guiding of the psychotherapy. But still, it's, I think, beside what you said, in addition to this, it's obviously depend on the doses and how you work. But just to open a space for a person to think, to take a look on what's he going through, what he feel, and it's an opportunity for deeper psychotherapy and more efficient.
Dr. Olan, I've heard you refer to ketamine in Shaare Nefesh in the clinic that you work in, used as a psychotherapist's assistant. Maybe you can share a little bit about the clinic and the work that you're doing there, and then Dr. Yehuda, we'd love to hear a little bit about your clinic also.
So, with under Shaare Tzedek Medical Center, and with the help of the Jerusalem Fund and of the supporters, we opened like 6 months ago this project for treating people suffer from depression and PTSD in the war, and we use ketamine-assisted psychotherapy. We have, as we say, good reason to think that it's something that's open way to do faster processes and more efficient in order to make the treatment accessible for more people. We understand that even if we are facing a situation that's mm, a huge amount of people who suffering need treatment, and the system cannot offer all of them in treatment. So we must open and find new ways to be more accessible and treat better and faster people. And this is something that's we already treated like 15 people, soldiers that injured mentally or and physical, and a civilian, survivors from Nova and things, and we already see it's not yet empirical numbers that we collect already, but when we present, when we have more, but the cases are very exciting, like to see people that suffered and after just 2 months of treatment can do things that they couldn't, feel different and get their life better. It's exciting and very important.
It's amazing. Maybe you could tell us just a few short words about how the psychotherapy and the ketamine are combined in this process.
So the psychotherapy is the main thing, and we usually do a process of two times a week. That's each time when a patient came, he get also psychotherapy and also ketamine with the guidance of his psychotherapist. This the process starts with just psychotherapy to build the plan and the relationship, and ended also with a few meetings of just psychotherapy to conclude and collect all the benefits.
It's beautiful. Thank you. Dr. Yehuda, maybe a few words about the work you're doing?
Well, what we're doing is testing whether there's a difference between giving ketamine straight, the way that people mostly receive ketamine in ketamine clinics these days, versus ketamine-assisted psychotherapy, which doesn't have a uniform protocol, so we're kind of making it up as we go along, trying to apply the kind of psychotherapeutic approaches that we think will fit it. But it's really using the medicine in a completely different way. Instead of suggesting to someone that there's some brain problem that needs to be fixed in some way neurochemically, we're saying that this drug is going to loosen things up so that you are able to access and talk about difficult material. It's a completely different model of care. So again, there's every reason to believe that it could be a good thing, but until we do the study, we're not going to know. That's a problem a lot with the field of mental health. People have really strong feelings about what to do, but they don't always have the data to back it up. But here's what we definitely know. We know that people want to feel change quickly when they enter care. They definitely want to know something has happened. If you're in pain and you go to a doctor and he gives you a painkiller, he may not have solved the reason that you have the pain. But it's a really good first step in that direction of solving a problem. The other thing that we know is that when it comes to mental illness, you have to engage with it. You can't just passively lie there and have some medicine take some problem away. You have to be in it. You have to talk about it too. And so engaging in a therapeutic process is very important. Now, in Israel, but it's also true around the world, we have another issue, and that is that we're not always dealing with a post-trauma. We're dealing with people that are constantly being challenged every single day. You don't know what today is going to bring. You're under enormous stress. People have children and spouses, maybe grandchildren that are deployed. They're worried about them. They're worried about the political situation, the hostages, what may or may not change. So you're trying to heal from the past while the present, you can't fully tell somebody, okay, it's over, let's put that in the past, because that's not true either. So what we're doing is something a little bit different, and that is we're building resilience. And so what we're hoping is that by getting somebody to be able to look at what bothers them, they will be able to develop the capacities to self-regulate, self-soothe, confront problems, and know that even though something has happened, they have what it takes to be able to survive it.
And I think you spoke also protocol is about protocol. It's difficult when you like meet all those cases and each one of them went through terrible things, but different things, and so I think the most important advice you gave us when we start about how to do it is first of all to take the advantage of be able to work with ketamine with not as with strict protocol, but follow the specific patient needs as psychotherapy works. I think is something very precious, and it's I think we all there is the neuroplasticity part that's work and help also the psychotherapy, but the added how ketamine add value to psychotherapy is something that's you first of all have to follow the psychotherapy, follow the patient. He's the center of the protocol, and this is something that's very important.
Yeah. And one day we can do studies really comparing psychotherapy with and without ketamine, ketamine with and without psychotherapy. These are all things that we need to learn, but the real impetus for this was to just roll up our sleeves, start treating people.
Thank you both so much.
Penny, where hopefully can we go next? Please God, in peacetime. But what are the plans at Shaare Nefesh? What is the hope for how this vision kind of grows, particularly around research and trials at the clinic?
So, as we've mentioned before, our treatment protocol is not under clinical research, which means that we can be very generously flexible with the needs of the patient in regards to dosage, in regards to how many treatments a week, for how many weeks. So we can actually tailor the protocol. But we are going to be doing a lot of really important, groundbreaking research in the clinic as well. Hopefully expanding from ketamine to other compounds as well, but even with ketamine, focusing on outcome of our protocol and focusing on combining psychotherapy with ketamine and the importance of that piece, being able to measure empirically that and put that out there is, I think, a very important goal of ours. We have our research team in the clinic. We have head of our research team, Dr. Aaron Cherniak. He's done quite amazing research with Jewish psychedelic experiences. He's also a psychologist and one of the therapists on our team. And he's going to be heading the research together with Dr. Sinai Oren, our medical director. I think that the research in this field has so much to still be discovered and said. Ketamine has been researched for mainly for depression and for resistant depression, and expanding the research into PTSD is something that we are going to be pushing forward together with other amazing international partners such as Mount Sinai Hospital and Professor Rachel Yehuda's lab and others. So the research part is very important. It's going to be further developed in years to come, and right now we're still focusing on creating the protocol, putting the care out there, making sure that people get the treatment they need. Another thing that we would love to research is training, and what is a competent training for therapists to be able to provide ketamine-assisted psychotherapy. We started with that with our the training that we've already done about 6 months back. The experiential part of the training, which includes the therapist receiving ketamine as part of their training so they can know what their patients will be experiencing, was a big part of that. And hopefully realizing what is the better ways we can develop for therapists who are already trauma informed and trauma specialized to utilize other tools. I think that's another part that we're going to go down. Hopefully in the future we can expand also into maybe addictions, maybe eating disorders, whatever other mental health situations that ketamine with psychotherapy could be useful for. And together with always focusing on providing the best care that we can to our clients.
Yeah, and there's something about psychedelic assisted therapy that is really important for me, that there's this trans-diagnostic, trans-therapeutic potential. And you've got here the infrastructure, the personnel, you know how to do it. So definitely you could use other medicines other than ketamine. You could work with addictions and eating disorders because you've got the foundations here, and psychedelics can help people in so many different ways. I just want to ask you about kind of government policy and the legality of psychedelics and psychedelic therapy. So looking to the future, what do you hope could happen there, and how could Shaare Nefesh help that actually to come about?
Yeah, that's a great question. So the situation in Israel is that we have clinical research ongoing for many years, mostly through the efforts of MAPS Israel, with MDMA for PTSD. That's the classic treatment that's known here in Israel. There have been movies done about it. There's some, newspaper pieces done about it. It's common knowledge that MDMA treatment for PTSD is being researched. Additionally to that, we have some psilocybin research being done here in Israel, and maybe other compounds that will show up in the next few years. But like I stressed before, the fact that we're not doing this treatment as part of a clinical research, but we have the ability to give really good psychotherapy in tandem with psychedelic substances, in this case ketamine, allows us not only to expand the protocols of care and the research, but also perhaps to affect the way that the policy will be decided upon in the future. So we've already created, just by training therapists here in Israel and opening this clinic, we've created 2 or 3 more additional ketamine assisted psychotherapy programs here in Israel, who are different hospital teams that are working, some of them working with us, some of them learning from what we're doing, and basically spreading that word. Private ketamine in Israel is starting to be provided in private clinics, and it's still very early on, but I think that will develop and spread as well. It's hard to say where the policy will go from here. FDA disapproval of MDMA last year was kind of, I think, of a turning point for some of the industry in the field, and it's felt here in Israel as well, obviously. But hopefully, like I said before, the fact that this country right now and the great demand for mental health solutions and the willingness to be innovative that comes when you're in a state of war for this amount of time, I think perhaps the different policies that will be decided on will be more favorable for this type of work. I think it's up to us as therapists and as clinics to create the data and prove that this is a good way to go forward, and also to learn what the best way would be to put that in place. We are dealing with substances that have powerful transformative potential, but that also means that they might be dangerous in the wrong context, in the wrong situation. And I think that working slowly and surely to create the evidence-based practice and creating the right type of training and creating the right type of supervision and collaboration. I think collaboration is key. Creating the different coalitions needed, whether in research or therapy, and hopefully all of that will push forward. And within a few years, we'll see a lot more of this work being done. It's already been, over the past 5 to maybe 7 years in Israel, it's been growing and growing, and I see no reason for it to go any other direction. But like I said before, as one of the leading players in this field, and also as a public health kind of player in this field, we are not taking any risks, and we're doing the hard, slow work that needs to be done in order to change that.
And that's how you change minds and get policy to evolve. And it's beautiful that the work here at Shaare Nefesh is a catalyst for other hospitals to come and learn and to inspire and to show, here's the data, here are the outcomes, here's the protocols. Beautiful.
It is, and hopefully we can become a training center, maybe not only for people here in Israel, but for Jews around the world, and perhaps for therapeutic teams around the world learning from the type of work that we're doing here. Like I said before, I'm very sad about it. I'm very happy that the difficult circumstances have put us in a place where we're changing the game. It's a different game now, and we're changing with it.
Amazing work.